Okay, I'm going to do a case study, and I'm going to just read off the case study and then I'll talk about it. This little girl named Annie is an 8-year-old referred for an evaluation, and I'm the speech language pathologist assigned, and we are going to do a comprehensive assessment of spoken language. And I'm going to report my findings and just talk to you about how I would go about treating and working with evaluating this child. So that really only gives me a small amount of information for the case history. So I know that she's 8 years old and she's having difficulties with spoken language or expressive language. And what I would want to do is sit down with a parent and interview the parent. What are the main concerns? Where is she having difficulty in certain subjects? And then I would also ask about any past therapies that she's attended, what a typical day is like for her as far as what kind of activities does she like, what does she like to do with her friends, and just kind of get a feel of concerns and learn a little bit more about her. And so the first thing I would do in the evaluation is look at spoken language. So we're going to look at obviously the content, form, and use of language. In the area of semantics, is she able to use a variety of vocabulary words? Is she using abstract and concrete vocabulary words? What are her nouns like? What are her verbs like? Is she using adjectives? And just really look at a possible speech sample to see her utterance length as well. So we want to look at semantics, we want to look at syntax, which is is she using simple or complex sentences? Because at this age, she should be using complex sentences with possible clauses. And we also want to look at her grammatical, her grammar, her ability to use past tense, possessives. Is she able to use present progressive? So is she using those appropriately? She has talked, she will talk, she was talking, things like that, to see if she is sounding intelligible at her age. So we want to look at semantics, syntax, morphology, as well as her pragmatics use. So in a conversation, is she using communicative intent? Is she turn taking appropriately? Is she able to repair a conversation? And also, is she asking questions? Is she engaged? So we want to look at her ability to communicate using language as a social tool, and also thinking about how she interacts with her friends and getting along with friends. And a parent interview is really important, as well as a teacher interview, and to get an idea of how she is in the classroom. So looking at those multiple settings of classroom, home, and then getting to know her in therapy. And so after we give the assessment of the spoken language, we do also want to take a look at her receptive language to make sure that that is intact, and her auditory comprehension, there's no issues, and possibly doing a hearing screening just to make sure or find out from the parents when's the last time her hearing was checked. So yeah, and if her scores are low on the test that we give, then we'll go ahead and talk with the parents and let them know Annie scored in this range compared to her typical peers. And for example, if she was if her standard score was in the 50s, then we would let the parents know that she is below average for her age and that therapy is warranted. And what we'll do as the speech language pathologist is set up goals to encourage her to communicate effectively and look at her strengths and look at her weaknesses and drive our therapy from those details that we get from the assessment, from our informal connected speech sample, from the case history. We want to compile all of that information and be able to give it to the parents and say, this is what we're going to work on. We would love for you to work on it at home, come to therapy, come into the sessions with us, and learn some techniques so that we can get her expressive language up to par and up to speed with her typical peers.